Hello and welcome to the Daily Med. Daily Med, a medicine channel for medicine lovers. Today, in this video, we are going to talk about combined oral contraceptive pills. We are going to discuss what are combined oral contraceptive pills, how they work in our body, its mechanism of action, how to start these pills, what are the benefits of taking these pills, what are the risks associated with oral contraceptive pills, and at last, the women who should avoid taking these pills. So these are the headings which we are going to discuss in this video. The combined oral contraceptive pill, often referred to as the birth control pill, is a type of birth control that is designed to be taken orally by women. It includes a combination of an estrogen, usually ethinyl estradiol, and a progestogen, especially a progestin. When taken correctly, it alters the menstrual cycle to eliminate ovulation and to prevent pregnancy. Now let's see how it acts on our body. Normally, the pituitary gland present in our brain produces two hormones, that is, follicle stimulating hormone and luteinizing hormone. This follicle stimulating hormone, also known as FSH, acts on the growing follicles in the ovary and produces estrogen. This estrogen then acts on the endometrial lining of the uterus, thereby helps it to proliferate. That means estrogen helps the endometrial lining to grow. Also, the luteinizing hormone, also known as LH, acts on the growing follicles and ruptures it, thereby producing an egg. The remaining follicle becomes corpus luteum and produces progesterone. This progesterone then acts on the endometrial lining, thereby making endometrium secretory and stable. At the end of the progesterone withdrawal, the menstruation happens. So this is the normal cycle in woman's body. When a woman takes combined oral contraceptive pills, which contains low-dose estrogen and progesterone, this low-dose estrogen and progesterone acts on the brain. Thereby, brain stops producing FSH and LH from the pituitary. If the FSH and LH is not produced, thereby the estrogen from follicles is not produced, and also the progesterone is also not produced. Let's make it more clear. Since because of the progesterone and estrogen present in the pills, these low-dose pills will send the signal to the pituitary in the brain to stop producing FSH and LH. So now the body will stop producing high level of estrogen and progesterone in the body. Also, since there is no LH, also there will be no rupture of the follicles and no egg or oocyte will be produced. No egg, that means no chance of pregnancy. But here the question arises. If the body will stop producing estrogen and progesterone, that means that lady will not have menstruation now? No. The lady will still have regular menstruation every month because the body has stopped producing high level of estrogen and progesterone, but the low dose progesterone and estrogen present in our pills is enough to make endometrium grow and to make it stable. Normally, the oral contraceptive pills are given for 21 days. That means the woman will stop taking these pills on the 21st day. Since there will be no progesterone and estrogen now available in the body, the endometrial lining of the uterus will now start shedding and the lady will have a regular menstruation after 6 to 7 days. So, when we should start taking these pills? Normally, it should be started between 1st and the 5th day of the menstrual cycle. So what are the benefits of combined oral contraceptive pills? Since there is no ovulation, that means no egg is being produced. So now the pregnancy will not happen. Also, if there will be no ovulation, no prostaglandins will be released and the patient now have very less painful menstruation. That means the patient will get relief from menstrual pain. The patient will have regular menstrual cycles. She will be protected from various cancers in the body as the high dose estrogen will not be available in the body. Also, the cases of benign breast diseases will decrease. So what are the risks from combined oral contraceptive pills? There is increased chance of chlamydia infection. There is also a minimal risk of cancer of the cervix in the uterus, and that is why the doctor should monitor their patients. Also, there is an increased chance of gallstones. Also, there is increased chance of hepatic adenomas. And at last, who should not take these pills? Patients who are pregnant, patients with breast cancer, patients with uncontrolled diabetes, patients having severe hypertension, patients having liver disorder, patients having hyperlipidemia, also the patients having known case of hepatitis and a known case of coronary artery disease should not take these pills.
If you like this video, hit the like button. If you want to know more facts about human life, please subscribe to DailyMed. Also, comment down if you have any queries and questions. Don't forget to press the bell icon to get notifications of our updated contents. Also, don't forget to follow DailyMed on Facebook. Thanks for watching DailyMed.